When it comes to the cognitive model, now we're focused on your thoughts. Now we're focusing more on your internal process, how you experience something, how you interpret what happened to you, right? So our interpretations of what's going on around us matter. So I want you to imagine that you're walking down the street and someone bumps into you. That is the behavior that happened. That is the experience that happened. You're faced with the question, though, did they do it on purpose or was it an accident? That would be a cognitive process. You would have to interpret whether it was intentional or unintentional. Now, if you assume that it was intentional, we could guess your behavior is going to be significantly different than if you interpret it was unintentional. In fact, a common source of physical fighting is interpreting whether someone did something on purpose or not. So we focus on your assumptions, your thoughts, your attitudes, and the framework of the cognitive model is that maladaptive or faulty thinking leads to unhealthy or maladaptive behavior. So faulty thinking can come in many different ways. It could be faulty assumptions or attitudes or overgeneralization, right? So it is not uncommon for a person to have an experience that's aversive. And then if you take that one experience and generalize it to other aspects, well, that's going to interfere with your ability to function properly. So when we do cognitive therapy, now we want to understand your maladaptive thinking, and we want to do what's called cognitive restructuring. Cognitive restructuring is the process of taking your maladaptive thoughts and teaching you healthier interpretations, a more pro-social way of thinking. And if we can teach you alternate ways of thinking that are healthier, we believe that your healthier thinking is going to result in fewer maladaptive behaviors. So one of the classic models of therapy is called cognitive therapy. And this is Aaron Beck's model. Now, when we talk about cognitive therapy models, it's not just Aaron Beck. There's Meichenbaum as well. There's many different cognitive models. But when it comes, there's Albert Ellis as well. When it comes to the idea of how does Beck treat therapy, we're going to recognize, identify maladaptive thoughts. We're going to restructure your thoughts. The therapist takes an active role in pushing back and challenging dysfunctional thoughts, inviting the client to try out different interpretations and apply it outside of the treatment room. So when I hear a client say something that I think might not be appropriate or is maladaptive, I usually say the phrase, I'd like to gently push back against that, so that they know that I'm challenging this dysfunctional thought, but I'm not doing it in an aggressive or unhealthy way. I want them to be able to think about things in a different mindset. Now, cognitive therapy is used significantly with depression. Now, Aaron Beck talked about the cognitive triad, right? So there are three aspects of things that lead to depression: a negative view of oneself, a negative view of one's future, and a overly generalized view of negativity. So these are three aspects of the cognitive triad, right? So if it's not going to change and it's global, right, and I am the problem, I'm going to be more likely to develop depression versus if I have a more positive view of the self, positive view of one's future, positive view of the possibility for change. So that's the cognitive model. And let's evaluate, the strengths. Well, it has a lot of appeal, especially when we talk about talk therapy, because you're engaging in this Socratic reasoning where you're having a conversation and you're questioning what a person's beliefs. So that's useful, very useful. Now, one of the nice things about it is that cognitive therapy works with a human model and the human mental process. It does not, you're not going to use a cognitive model of therapy for animals, obviously. We do see that there is a connection between faulty thinking and symptoms of psychological disorders. We see that it is heavily research-based and is useful in a broad range of psychological disorders and so forth. But by itself, one of the criticisms of the cognitive model is that it, similar to all of the previous models, if all you have is cognition, it's too narrow of a thought process. It's too narrow of a framework. Cognition is only part of our mental processing. We also, similar to the behavioral model, put too much of an emphasis on the present. Now, for the cognitive model to work, you have to have the ability to reason and have abstract thought and be able to use your mental abilities to see things through another prism, another lens. And because of this, the level of insight a person has and the level of ability to abstract is going to make it more effective for some than others. And then in terms of the difficulties a person faces and the cognition they have, it's hard to determine whether the negative thought process was the cause of the difficulties or the byproduct of the difficulties. So we don't know which one came first. And that is the cognitive model. So I'm going to stop the recording here.